Can you remember when and why you decided to pursue a career in the healthcare sector?
Yeah, I always wanted to pursue a career in the healthcare sector because from a young age I always felt that a career in health and specifically in nutrition was a way that I could make a positive impact on the lives of others and be able to work with individuals and give them the confidence and the skills that they need to be able to, whether it's make healthy choices for themselves or be able to manage their specific conditions as well. Nutrition is always changing and there's always so much emerging evidence as well, so it's a really exciting career that you're able to continue to learn and grow as well. And I think it's just always excited me to be able to work with people and kind of provide them with the skills and knowledge to understand that link between food and our health as well. So it's just always been something that I've been really excited about, and I think it's just such a various, like there's so many things you can do within health, not only as a dietitian but just so many areas that you can work in as well.
What's your current position at TDHS and what was your pathway to the role?
My current position here at TDHS is as an accredited practicing dietitian. So I've been working in several organisations within Southwest Victoria as a dietitian, and have been lucky enough to get a role here as a dietitian in Timboon as well. So my pathway to the role, I completed an undergraduate health science degree at Deakin University in Geelong, and then I went on to complete my Master of Dietetics in Burwood at Deakin University as well. So I studied for about 4.5 years, and that involved different placements and learning lots of different skills that I'm able to apply to my current role now. And within my current role here at TDHS, I'm able to work across a variety of different settings. So whether that's working with patients on the wards or residents or community outpatients, so getting referrals from GPs or patients in the community that may have self-referred for a dietitian appointment as well. And also working with the food service staff as well, so completing menu reviews, and it's just such a varied role here. So it's been great to have all those aspects of dietetics within my current role here.
Why do you enjoy working in the healthcare sector in Timboon?
I really love working in the healthcare sector here in Timboon because I grew up in Warrnambool, and it's always been, whilst I moved away to complete my studies, it's always been my passion to bring the skills and the knowledge that I got throughout my studies up in Deakin to be able to bring that back to the community and individuals within Southwest Victoria. I think it's, as I mentioned previously, it's such a diverse role and I'm able to work across so many different aspects of dietetics, and I think that's what's always brought me to be really passionate about working in a rural and regional setting, to be able to have such a diverse caseload and to be able to work with individuals of all ages as well. It's just definitely a really diverse role, and I'm able to kind of work across, build my skills in lots of different areas, whether it's from a clinical or a community or a food service aspect as well. And there's even aspects of health promotion here as well, which I just love doing all those different things combined into the one role. And I think working within Timboon as well, it's just such a lovely community. It's very community oriented town as well as organisation as well, and it's just a really lovely team to be a part of. So very much enjoying my time here at TDHS.
Explain a typical day for you at TDHS.
I don't think I would have a typical day here at TDHS. As I mentioned, my role is very varied across lots of different aspects of nutrition as well. So typically most of my days would be coming in and checking my emails and checking whether any referrals for the day or any clients that might be booked in as well. So I could be seeing community outpatients if I've had a referral for a wide range of reasons as well, whether it's things like gastrointestinal issues or diabetes management, weight management, lots of different things that I've been seeing individuals within the community for here. It could be seeing patients on the wards if I've had referrals from the nursing staff, so to be checking in with nursing staff to see if there's anyone that needs to be seen as well, or residents as well. There could be meetings on throughout the day, and I've also been working with the food service staff as well to develop a menu review for here at TDHS, just to assess the nutritional adequacy of the current menu to make sure it's meeting the patients' and residents' needs as well. So working closely with the kitchen. There's always some professional development to take part in, and now that we're able to do a bit more face-to-face things, we've been able to implement some programs as well. So we've started the infant program as well for new mums and bubs, so discussing things like introducing solids and yeah, there's just always, every day is really different, so there's definitely not a typical day, which is kind of what I love about it. Yeah.
What would you say to someone thinking about a career as a health or care worker?
I would definitely recommend a career as a healthcare worker or a care worker to anyone that's interested in working with people and making a positive impact on other people's lives. It doesn't have to be, in working as a dietitian as I am. There's so many different aspects of health that you can work in. There's lots of different allied health roles that you could work within, whether it's social work or occupational therapy or speech therapy or physiotherapy, lots of different aspects as well. There's administration and nursing roles and lots of promotion roles within the community as well. There's just such a wide range that you can go into as well, and like I've mentioned, every day is just completely varied as well. Yeah, and I think it's just, if it's something that you're interested in doing, then I'd just recommend to go for it as well. It's definitely, yeah, very rewarding job.